Beneath that subcutaneous layer that is below the dermis lies our muscles. So muscles exist below the integumentary system or beneath the skin, and deep to our muscles is our bones. So we're moving deeper. And let's talk about the musculoskeletal system. So as the name suggests, it's a combination or integration of our skeleton and our muscles working in tandem. So here we can see the anterior and posterior views of the human skeleton. Now, we'll talk about how this is color-coded, and it's showing the distinction between the axial skeleton, which includes the head, chest, rib cage, and vertebral column, versus the appendicular skeleton. Appendicular means limbs as well as girdles, like the pelvic girdle or shoulder girdle. So think appendages, appendicular skeleton, limbs, and the axial skeleton refers to the core, more core region of the body. Functions of the musculoskeletal system include support. It's kind of like the framework. Think of like the framework of a house, for example. Without the skeleton, we would be a shapeless mass of soft tissue. So it provides structural integrity that is required to stand upright and hold our organs, largely our support where our organs are located. While the bones provide structure, muscles provide power or work by pulling on the bones at various joints. So the musculoskeletal system allows for everything from large movements to fine movements. Finally, protection. So this is kind of the armor function. Your skull protects the brain, right? Your thoracic cage, the ribs, protects the heart and lungs within. So the skeletal system largely provides protection and also mineral storage. Our bones are this large reservoir for essential minerals like calcium and phosphorus. When our body needs these minerals, it can withdraw them and mobilize them from the bone tissue into the bloodstream. So this slide, again, reiterates, we've seen this combining form before, osteo. There are 206 bones that compose the adult skeleton, and I don't expect you to know the name of every single bone for this course, but being aware of the distinction between the axial and the appendicular skeleton, and the specific regions that represent. So the axial skeleton, again, being the head, thoracic cavity, and the vertebral column, and the appendicular skeleton referring to the limbs and the, so both upper and lower limbs. Now let's talk about, we've again seen some of these combining forms before, and we're going to talk about distinguishing features between these structures. So muscle, coming from root myo, is really the engine, right? So it's one of the 4 primary tissue types in the body, and its job is to contract and create force that drives movement. Now we'll talk about the difference between tendons and ligaments. Think of these as the glue, if you will, holding structures within our musculoskeletal system. And the distinction here is that tendons act as the anchors. So here we have the tendon of the quadriceps femoris muscle, and it is anchoring muscle to bone. So it's anchoring the quadricep muscle to the patella. So tendons connect muscle to bone. Ligaments, on the other hand, connect bone to bone. So think your ACL, and we'll see the ACL on the next slide. This ligament connects bone to bone in the knee. So connecting specifically the femur to the fibula here, and also to the tibia, you have many ligaments. And of course, we can't just have hard bones grinding against each other. That would be extremely painful. And this is why we have cartilage, by the combining form chondro. It is a slippery, elastic connective tissue that is found at the ends of our bones, and it acts as a shock absorber and also a lubricant. You can also feel cartilage on the tip of your nose and your ears, but within our joints, it helps with lubricating these surfaces that rub against one another. And so in a joint, arthro, this is the articulation point or the meeting point between two bones where movement happens. And it's important to have that cartilage there to reduce friction in this region. So I have some videos here that I'm going to play. This is just showing, let's see, hopefully she plays. Okay, you may, if you refer back to this video, especially if you download it, you press play on the slideshow. They should play, but it's really just highlighting the movement of, here we have the anterior cruciate ligament, so the ACL, that is within the knee joint, showing how muscles actually pull on bones as well. So the naming of skeletal muscles is remnant of the function of that particular muscle, but also other aspects of the muscle, such as size. For example, the gluteus minimus or the gluteus maximus, literally for maximus, it literally means largest. Minimus means smallest. So some muscles are named based on how big they are. Other muscles are named based on their shape. The trapezius is named because it's shaped like a trapezoid. Some muscles are named based on the direction that their fibers run. The rectus abdominis muscle, for instance, has fibers that run straight, meaning rectus, or rectus means straight, along the abdomen. You also have the rectus femoris that also has fibers that run straight. Location. So certain muscles are named after the body region where they're found. The pectoralis muscle is located on the chest, and it comes from Latin meaning pectus, which means breast or chest. Some muscles have multiple heads or points of origin. The biceps muscle, for example, has 2 heads, bi meaning 2. Similarly, the triceps has 3, quadriceps 4. Origin and insertion. So our sternocleidomastoid muscle. Some muscles describe their attachment points. In the sternocleidomastoid, for example, it attaches to the sternum, the clavicle, the cleido, and the mastoid process of the skull. So if we break up the words into component parts, we see those structures that the muscle attaches to. So by breaking up words into component parts, understanding the meaning of the segments of these terms, especially for the gluteus minimus and in terms of size, we can see that all of these names are really rooted in or based on these medical terms, right? And the inherent combining forms that are within these words. Terms like vastus, maximus, longus are other ones that indicate size. And for muscle action, so many muscles are named for the movement that they produce. The adductors of the thigh, for example, like the longus, brevis, and magnus, they all move the leg towards the midline of the body. So adductors is meaning adding, and we'll see these on a upcoming slide here. The key is, if we break down these words, we can gain information on the type of muscle, the location, size, and so forth. For a brief review of muscles, so I'm just going to walk through specifically what's on the slide and in this image. So at the highest level of organization, skeletal muscle is composed of several types of tissue, and specifically bundles of muscle cells. And another name for muscle cells are muscle fibers or myofibers. That's a single muscle cell. So a whole muscle is contained within the epimysium, which is a layer of dense irregular connective tissue, and that surrounds the entire muscle. It protects the muscle from friction against other muscles and bones. The perimysium surrounds fascicles, and we can see another fascicle here. So a fascicle is a collection of myofibers in a bundle within a muscle. So if we zoom in deeper, we see the whole muscle and then a collection of myofibers that can behave synergistically is basically bundled into a fascicle. And each fascicle is encased in a layer of connective tissue called the perimysium. If we go even deeper to that, within each fascicle, there is a fine sheath of connective tissue called the endomysium that surrounds every individual muscle cell. So peri, we've seen already before, meaning surrounding. Endo means within because it surrounds every individual muscle cell, so it's the deepest layer of connective tissue. Epi, we know, means above, upon, so the epimysium covers the entire muscle. Now, at the cellular level, we can look at the individual structures that make up a muscle fiber. So here we have now zoomed into a single muscle fiber. And a muscle fiber is a single multinucleated muscle cell. It's encapsulated by the sarcolemma, which is the specialized plasma membrane of a muscle fiber. And within is the sarcoplasm. The sarcoplasm is the cytoplasm of a muscle cell. The sarcoplasmic reticulum, represented here by this mesh-like network, is a specialized smooth endoplasmic reticulum that forms a network around each myofibril. So around each muscle fiber is this smooth, specialized sarcoplasmic reticulum. Its main function is calcium storage. It's going to store and release calcium ions, which are essential for contraction. So when a muscle becomes excited by the neurons that innervate it, that action potential that is generated, that electrical signal, travels down the T tubules, this kind of blue-green network here, which penetrates into the muscle cell's interior to ensure that that action potential reaches all parts of this muscle fiber simultaneously. That will trigger the release of calcium from the sarcoplasmic reticulum, and calcium will bind to our contractile proteins that exist within the muscle fiber, and we can see them organized here, the myofibrils. These contractile proteins called myofibrils are what facilitate a muscle contraction. They're the functional contractile unit. So the myofibrils contain sarcomeres, the functional unit of skeletal muscle. We call sarcomeres the functional unit because each sarcomere will shorten and contract to produce force. So muscles generate pulling forces, and muscles are unable to, in general, push. And this pulling force is achieved as the sarcomeres shorten and contract. Let's see if this video will go. I am not sure why these videos are not playing. Again, let's see if I can do this. Sorry, guys. So you're welcome to play this video if you download the PowerPoint. This is just simply zooming in and showing the various functions of each of the myofibrils and showing the contraction from a whole muscle down to the cellular level. So skeletal muscles themselves are attached to bones, as I mentioned, via tendons at two or more points. So when a muscle contracts, it creates tension between those points, pulling the 2 points towards each other. So the origin of a muscle is the attachment site that remains relatively stationary during a particular movement. Typically, the origin is located proximally, so the origin will be closer to the center of the body or the axial skeleton, right? So it acts as the anchor or the fixed point that the muscle pulls against. And the insertion is the attachment site on the bone that moves when the muscle contracts, right? So this is usually located more distally, further from the center of the body. During contraction, the insertion is pulled towards the origin, and we can see that with the example of a bicep curl, right? So as the forearm rises, our bicep muscle is shortening and contracting, and that is bringing the insertion up towards the origin so that the muscle can shorten and contract optimally. So we can see the biceps brachii here. It is an example of a flexor muscle because it performs flexion, the act of flexing at the elbow. It is on the anterior side of the humerus, and again, its insertion is on the radius in the forearm. And behind, we can see the triceps in red, the triceps brachii. So biceps, because it has 2 heads, the triceps has 3 heads, and it's on the posterior side of the humerus, the upper arm. When, again, the muscle contracts, it pulls the insertion towards the origin. The triceps is an extensor muscle, though. So because it wraps around the back of the joint, we can see that its origin is kind of more posterior, and then it wraps around. It is going to, and so when it contracts and pulls, it straightens the arm. So this increases the angle of the elbow joint because of its attachment being on the posterior side and its insertion being kind of where it's located right here. And so this is what allows for the extension movement of the arm and why we call it an extensor muscle. And these 2 muscles are referred to as antagonist pairs because they are on either side of the arm performing the opposite movement of flexion versus extension. So extensor muscles, again, they increase the angle between 2 body parts. Other examples of extensor muscles in the body include the quadriceps, as we extend the leg straight, and the antagonist flexor would be the hamstrings. Other movements that can occur are abduction, where we raise the arms, or adduction is lowering the arms back to the sides. So this lateral movement of the arms outward versus towards bringing them back towards the body. Other unique movements are circumduction, so being able to rotate the wrist, for example, whereas rotation is such as rotating the head. Also, you can perform circumduction at the shoulder as well. And then we also have lateral and medial rotation. So if we turn our foot inward, this is referring to medial rotation of the leg. And then if we turn outward and rotate at the hip, then this would be lateral rotation. Okay, so there are some various muscle groups that are associated with these medical terms, right? So gluteus actually means rump, and the gluteus maximus, maximus being largest, is a very powerful extensor muscle of the hip. It's the primary muscle that's responsible for hip extension, which is the movement of pulling the thigh backward, essentially relative to the pelvis. So this allows us to stand up from a squat. We can see here, if we're doing even a one-legged lunge, this muscle is going to contract. And its main antagonist is the iliopsoas, which we'll see on an upcoming slide. Triceps brachii here is performing the antagonistic or opposite movement to the biceps to allow us to extend the forearm. We discussed the quadriceps already, as it's one of the primary, or it is the primary extensor of the knee. So as the knee extends and the leg straightens, the quadricep is driving that movement. Quadriceps, quadri comes from the fact that it has 4 heads. The rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. So these 4 heads aid in its extensor function. Hip adductors are a group of 5 muscles actually located on the medial inner aspect of the thigh. So because of their location, they are also sometimes referred to as the groin muscles, and they allow us to squeeze our knees together. If you kick a soccer ball with the inside of your foot, you're also using the hip adductors. So add means towards, duct to lead or bring, and or refers to one that. So one that is bringing toward, or bringing together, if you will. And there's that iliopsoas, as I mentioned, and so it is actually originating from the lumbar vertebrae. So it originates from attachments to the bones of the vertebral column, and then it's going to insert, here we can see on the humerus, so near the hip joint there. So again, the origins are always the stationary anchors, and we can see that here. Its function is hip flexion. So when it contracts, it shortens and pulls that insertion point at the femur towards the origin at the spine and pelvis. And so it lifts the thigh towards the torso to perform hip flexion. The latissimus dorsi, if we recall, what's the dorsal surface of the body again? It is the posterior surface. So the latissimus dorsi largely originates here at the vertebral column, and it is going to insert at the top of the humerus here. It is actually the largest muscle of the upper body and is responsible for very powerful downward and backward strokes of the arm. So it actually originates from the back, we can see here, and then it wraps around the front to under the armpit to the front of the humerus. This is why it can rotate the arm inward because of this unique attachment point. And one more group here, we have highlights showing the movement of the trapezius. The trapezius has this name because it's this large, very superficial muscle that covers the upper back and neck. And it's named for this trapezoid shape when both sides are viewed together. So again, I don't expect you to remember the name of every single muscle for this course. However, I do want you to be familiar with the basis of naming muscles, as we've discussed on the previous slides. So how the name of muscles is suggestive of its location, size, and so forth. So here we have the many combining forms that are associated with the musculoskeletal system listed here that we've talked about previously. So cost versus chondra, referring to cartilage. Cost is rib. Cranio, skull, just as a review. Lumbo is referring to loin or waist, so the lumbar spine, for example. Muscule is muscle or myo or myos, so there are renditions of myo that is related to muscle. Myelo is similar to myo, but myelo is specifically pertaining to bone marrow. And we've seen myelinoma, which refers to cancer of the bone marrow. Now, oste, we've seen bone, pelvis. Spondyle refers to the vertebrae specifically. Spondylitis is inflammation of the vertebrae of the vertebral column. And we saw 10 vertebrae. So now let's move on to pathologies of the musculoskeletal system. So we'll start with bone and joint disorders. If you look at a normal image of a healthy joint here, you can see that there are two bones articulating with one another, and the point of articulation contains fluid, so synovial fluid, that helps to lubricate this region so that the movement is smooth and pain-free, and the ends of the bones are covered in cartilage. This is going to reduce friction and acts like a cushion to the ends of the bones. Now, before I get into the different types of joint disorders that largely surround around arthritis, let's talk about first, what is inflammation? So we know what inflammation is associated with, like swelling when we think of inflammation, or redness, for example. But inflammation is your body's defense response. It happens when your body detects something that it thinks is foreign or a problem, like damage or infection or something abnormal. So what actually happens during inflammation? A tissue is inflamed or appears red and warm because blood flow to that area increases. Blood flow increases to the area to bring oxygen, nutrients, and immune cells in order to heal or fight off any pathogens that might have been exposed to the body. This causes that heat and redness, right? That increase in blood flow, but it's serving to bring oxygen and immune cells to the region. Blood vessels in the area also become leaky. And what that means is immune cells will actually leave the bloodstream and enter the tissue in that region. So white blood cells, for example, can leave our bloodstream through tight junctions in our capillaries and travel to the specific tissue and region of the tissue that has either damage or trauma or an infection to fight off that infection. That causes fluid accumulation in the tissue and swelling. And finally, immune cells release chemicals. And so these chemicals are released by immune cells to destroy or essentially clean up the problem. These chemicals, though, also irritate nerves, and that's what causes associated pain with inflammation, or one of the things that causes associated pain. So arthritis, we know, refers to inflammation of a joint. We've seen this term before. But now these symptoms of arthritis that a patient experiences can be explained by this inflammation. So what's actually going on? Well, there's pain within the joint because the nerves become irritated by chemicals. There's swelling that occurs from fluid buildup as our immune system is sending immune cells to the tissue to attempt to heal the area. There's also stiffness that occurs from that swelling and damage and reduced movement. So all arthritis refers to inflammation, but the reason that the body is triggering that inflammation may be different depending on the type of arthritis that we're looking at. So let's start with osteoarthritis. We know for osteoarthritis, this refers to osteo is referring to bone, arthra is joint, and inflammation. So this image shows osteoarthritis, and it refers to wear and tear damage within the joint over time. Cartilage, again, normally acts as that smooth cushion in the joint. Over years of use, this cartilage begins to break down. That's because cartilage has really limited ability to repair itself. Cartilage has a very poor blood supply. And so repeated stress over time slowly causes micro damage to cartilage, and that damage accumulates. So as we can see here, the cartilage has worn away due to wear and tear over time, and the ends of the bones are now exposed. So the bones will rub against one another. That causes inflammation because bone rubbing is causing physical injury to the ends of the bones at the kind of more microscopic level. And so the body detects this damage, and when it detects this damage, it is going to trigger that inflammatory response. So it triggers inflammation to try to repair it, but it's often futile because, again, that cartilage does not repair well. And so this causes chronic inflammation, chronic stiffness, and chronic pain in the joints. The longer you use the joint, the more wear that builds up. And this repair process becomes less effective with age. In addition, increased body weight is also going to cause more force through your joints. And so more force means that faster cartilage breakdown will occur. Now, rheumatoid arthritis is a completely different cause. So even though it's referring to joint inflammation, in this case, rheumatoid arthritis is caused by it's associated with the immune system. So it's an autoimmune condition where the immune cells are going to enter the lining of the joint because they mistakenly think that something is wrong here or is foreign. It's an autoimmune disorder. And they're going to release inflammatory chemicals into the joint space. They do that because that's what immune cells normally do to fight infection or to heal a tissue. But this is a chronic and uncontrolled state because it is an autoimmune disorder where the body is mistakenly associating this region with damage or a reason to cause inflammation. And so the body starts destroying the tissues that are found within the joint. It causes constant inflammation. So there's increased blood flow and fluid accumulating in this area. So there's going to be that redness, swelling, the breakdown of that cartilage as well, and the eventual erosion of the bone. So we can see here that the bone is a lot thinner in this area. And bone has been eroded away, and the body is essentially attacking this region and the cells within it continuously. It's actually more common in women because estrogen as a sex hormone affects how the immune system behaves, and research has shown that it can make immune system responses stronger and more reactive. Therefore, because this is an autoimmune disorder, it can have younger onset, right? So we see it in earlier ages as opposed to osteoarthritis. Now, gout. This is one that we haven't seen before. And gout is associated with the buildup of uric acid in a joint. Now, what is uric acid? So your bodies constantly break down what are called purines. If you remember when you learned about DNA, purines are part of our DNA, right? Purines are also found in food. And when purines are broken down, uric acid forms. So they're a metabolic waste product, or uric acid is a metabolic waste product of purine breakdown. Normally, uric acid dissolves in the blood and the kidneys filter it out. In gout, we often observe gout in individuals with kidney damage or kidney function that is not clearing out the uric acid well. Therefore, the uric acid begins to build up in blood and it starts forming crystals essentially. So this buildup of uric acid causes the release of inflammatory chemicals that cause intense inflammation. The big toe is the most common area that gout happens in. One reason for that is because it's cooler than the rest of the body, and because it's a cooler region of the body in the big toe, those uric acid crystals form more easily in the toe region. The feet also experience more mechanical stress from walking, which is more likely to trigger inflammation, and then the crystals accumulate there. So again, gout, this buildup of uric acid in a joint caused by too much uric acid being found in the blood, and that uric acid then accumulates, forming crystals that become localized to specific joints, most commonly in the feet or toes, and that causes this local inflammation and pain in those areas. Gout can be treated with certain medications that help the body to process that uric acid. Carpal tunnel syndrome. Now, let's talk about the actual structure here. So the carpal tunnel, carpal referring to wrist, the carpal tunnel is a narrow passageway in your wrist. The carpal bones make up the wrist, and sitting within this membrane here is a nerve called the median nerve. The median nerve passes through this tunnel in addition to some tendons that run through here that connect muscles to your fingers to allow for finger movement. But the median nerve is this key structure here because it's responsible for sensation in your thumb, in your index fingers, part of your ring finger as well, and it helps control muscles at the base of the thumb too. So in carpal tunnel syndrome, the nerve in this area becomes compressed. So the tunnel becomes very narrow. And so because there's not much extra space, there is pressure on that nerve. And so common symptoms include numbness or tingling in the hands. Common causes include repetitive hand movements. So individuals with careers that involve a lot of typing, using tools, because repetitive motion increases irritation of the nerve and inflammation of the surrounding tendons. Inflamed tendons take up more space because, again, blood flow is brought to the area, swelling occurs, and that compresses on the median nerve. So now let's shift gears a bit here to specifically bone disorders. Now we saw osteoarthritis, and this is often mistaken with osteoporosis. So let's talk about the difference. Osteoarthritis is specific to the joint and affects the bones within a joint. Osteoporosis is categorized by the progressive loss of bone, causing bones to become weak and thinner over time. So if we take a look at this image here, we can see a healthy bone. We can see that the matrix is nice and densely packed with bone cells. And you can compare this with the bone that has osteoporosis. This bone is much more porous, almost like a sponge with much larger holes. So osteo, bone, porosis, specifically pore is referring to pores or full of holes. So osteoporosis literally means porous bone. Now, as we know, bones are constantly being remodeled. We have cells called osteoblasts that build up our bones and contribute bone cells. And then we also have cells called osteoclasts that break down bone. So our body is constantly breaking down and building new bone. And in a healthy person, this process is balanced so that we are forming new bone cells and forming new bone tissue. And that is not occurring at a slower rate than the breakdown of the bone. However, in osteoporosis, the bone breakdown is happening faster than the bone building. This is naturally associated with aging. As we age, especially after the age of 35 or 40, those osteoblasts become much less active. Therefore, we have a net loss of bone as opposed to that balance between bone loss and bone gain. Especially in women, it's more common because estrogen levels decrease after menopause, and estrogen helps to protect bone density. So the likelihood of developing osteoporosis increases in general with age, but it's more common in females. The main risk of osteoporosis is fractures. Because the bones are weaker, even minor falls can cause a fracture since they are less densely packed. Now, I will actually mention as well, there have been many studies that show that resistance training exercise is very effective in helping to prevent osteoporosis. And the reason for that is as we use our muscles and as muscles contract, they actually pull on our bones. And the pulling on our bone is a force that stimulates bone growth or bone repair and the regrowth of bone cells. And so weight-bearing exercise is really effective in preventing osteoporosis. Adequate calcium and vitamin D levels as well help with that. So in addition to osteoporosis, here we have osteomyelitis. So osteomyelitis, if we look at the word, we have itis, inflammation. Myelitis specifically is referring to inflammation of bone and bone marrow, and osteo meaning bone. So in this case, we have inflammation of the bone and bone marrow. It's actually an infection-driven inflammation from inside the bone. So infection in the bone. Most commonly, it's caused by Staphylococcus bacteria, and the bacteria can get into the bone in a few ways, through the bloodstream from another infection that's occurring in the body, from an open wound or fracture. So if the bone is severely fractured, then bacteria can enter into the bone, or after surgeries as well. So once bacteria enter the bone, they begin to multiply. The immune system responds by producing inflammation to bring white blood cells to the area. White blood cells will destroy the pathogens, fight the infection, but this leads to increased pressure in the bone, reduced blood flow, and therefore parts of the bone can die if they have reduced blood flow. Now let's focus on the spine in particular. And there are particular diseases of the spine that are associated with the curvature of the spine. So first, let's talk about scoliosis. Scoliosis is a sideways or lateral curvature of the spine. It often looks like an S shape when viewed from behind. It can develop during childhood or even adolescence, and it can cause things like uneven shoulders because of that S curvature. One shoulder may appear more elevated than the other. And mild cases are relatively common and may not cause problems, but severe curves can really affect posture, movement, even breathing. And another spinal disease that can affect breathing is kyphosis. So here we see a normal shape to the spine from a lateral view, and here we see kyphosis. Kyphosis is an exaggerated outward or posteriorly rounded curve of the thoracic spine, and it causes a rounded or hunched back appearance. It can result over time with aging from poor posture, age-related degeneration of the spine, and severe kyphosis can also lead to pain, stiffness, as well as difficulty breathing. So why do we think that these particular spinal diseases are associated with difficulty breathing? So the reason for that is the lungs are located here in our thoracic cavity, and changes in the space due to changes in the shape of the spine can cause difficulty breathing. It can interfere with the expansion of the thoracic cavity if the shape of the spine is altered. And finally, lordosis is an exaggerated inward curve of the lumbar spine. This gives the back a more pronounced arch, and it can be caused by obesity, pregnancy, having the added anterior weight associated with pregnancy. So severe lordosis may lead to back pain, especially if the nerves here become impinged a little bit because of that exaggerated curve. Okay, so we have some practice here for you. So if you want to pause the video, do these on your own, and then we will take them up. So just to review the structural aspects of muscle before we go into muscle disorders and wrap up. So I'll encourage you to pause the video. Now, which term correctly describes a muscle cell? If you said myofiber or muscle fiber, that would be correct. The root meaning muscle would be my, or the combining form, myo. And the connective tissue layer that surrounds an entire skeletal muscle is the epimysium. So now we're going to talk about muscle disorders that affect muscle cells and connective tissue associated with muscles as well. The first is muscular dystrophy. So muscular dystrophy, and dystrophy referring to abnormal nutrition or abnormal growth or abnormal nourishment. So right away, this tells us that something is wrong with how muscle tissue is being maintained, nourished, and repaired. Muscular dystrophy is a genetic disorder. So a person is born with a mutation in a gene that is important for muscle function. In this case, muscle cells are missing or don't properly produce certain proteins that help to stabilize the muscle fiber. And there's actually a protein called dystrophin. So dystrophin is the protein, when mutated or defective, can cause for the tearing of the cell membrane of muscle fibers and an increased propensity to damage. So without those proteins functioning normally within muscle, the sarcolemma becomes very fragile. Every time the muscle tries to pull, the cell membrane tears, and this leads to progressive muscle fiber death and muscle wasting. So it's a very progressive and irreversible disease in general. The progression can be slowed through physical therapy, but in general, the muscle cells are very fragile, and because it's a genetic disorder, they damage very easily and cannot repair properly. Polymyocystitis, if we break down the word, poly means many, myo means muscle, and inflammation. So it's chronic inflammation of many skeletal muscles, leading to weakness. It is an autoimmune condition. When we see disorders like this that are very widespread throughout the body, they are often related to either genetic disorders or autoimmune disorders, as we've seen so far. So in polymyocystitis, the immune system mistakenly attacks muscle tissue in this case. So we saw with rheumatoid arthritis that the immune system was attacking the tissues within the joint. Now in polymyocystitis, the immune system is mistaking muscle tissue as foreign, even though it's not. This is self-tissue. But the immune system makes this error and it begins to attack muscle tissue. So immune cells enter the muscle tissue. They release inflammatory chemicals. They destroy cells and it causes damage to the muscle fibers. This therefore leads to weakness because the muscle cells are being destroyed. They become very weak. And finally, we have fibromyalgia. Something I'll note actually before we move on to fibromyalgia. These autoimmune disorders are typically treated with immunosuppressive medications. So these medications suppress the immune system to slow the system's attack on the given tissue, whether it's muscle or we saw with the joint tissue, or bone. So immunosuppressive medications are used to treat autoimmune disorders. So in polymyositis, we saw that the problem is inflammation damaging the muscle. Now let's look at this final condition where patients have pain and fatigue, but the cause is very different. Fibromyalgia is a bit different from the first two because it's not caused by muscle damage and it's not due to muscle breakdown or inflammation in the same way. So what's happening? In the case of fibromyalgia, it's a problem with how the nervous system processes pain. The brain and spinal cord become more sensitive to pain signals. And it's a complex disorder that kind of sits at the intersection of the muscular and nervous systems. Because even though there's no physical damage to the muscle fibers or connective tissues, there is intense, widespread musculoskeletal pain. Also fatigue and tenderness of the muscle. So there's often tender points on the muscle without any visible muscle damage. So to wrap up, the first two disorders are associated with, for muscular dystrophy, a genetic problem with muscle breakdown over time, polymyositis, an immune system, autoimmune disorder with inflammation and weakness over time, and fibromyalgia is related to the nervous system causing increased pain sensitivity in the muscles. So we can think about what is causing the muscle symptoms in this case, and that determines how it presents, how we treat it, and categorizes the disease. So have some final checkpoints here. I'm going to leave these questions and I'm going to then create a discussion board where you can post your answers to the questions. And then I will post the answers, the correct answers to these questions tomorrow. So later tomorrow, I'll post the answers. There are these questions and also these ones here. So I will again post the questions in the discussion board where you can answer them and then I'll provide the answers tomorrow. So here's a summary. This summarizes what we went over in terms of the integumentary system, its protective role, the structural layers of the integumentary system, and its accessory structures. We then went over skin disorders as well. And for the muscular system, we similarly went over the functions of the muscular system, important connective tissues, right? Like tendons, ligaments, cartilage. And we reviewed common movements, the naming system and terminology that's used to name muscles, as well as disorders associated with this system. So if you have any questions, feel free to let me know and be sure to attempt an answer at the questions in the discussion board and I will post the answers tomorrow. Take care. And if you have any questions about the worksheet or about this content, feel free to email me.